binding to macrophages. What happens is that when it binds to the macrophages, it releases granules which contain porphyrins and other mediators by effector cells, and it leads to lysis of B cells. And similarly, when it binds to B cell, it causes a signal to be sent into the B cell, which induces death by apoptosis. So the B cell just dies. So these are the three different mechanisms by which B cell depletion occurs in patients who are treated with this medicine. So, as I just mentioned before, that as CD20, the antigen is not expressed on the stem cells or fully mature plasma cell, the protective immunological memory is preserved with rituximab. And this was a landmark clinical trial. This is a reflex trial which showed the efficacy of rituximab for treatment of rheumatoid arthritis, which was refractory to anti-tumor or necrosis factor. So once the patient fails the regular or conventional DMR therapy, the guidelines are to use a biologic agent, and most of the Western guidelines recommend using an anti-TNF before using a rituximab, because of the B cells depletion therapy. But in our country, because of the risk of the infection and the cost price, almost half of this, we decided to use it in our patients and see the results. So the primary objective of this study was to determine the percentage of RA patients achieving improvement in their disease activity level at 6 months interval and using the DAS28. Secondary objective was to determine the percentage of RA patients who achieve improvement in their disease activity level at 12 months interval after starting the treatment, and to determine the safety profile of rituximab in Pakistani RA population. And also evaluation of response at 6 months, 12 months using the ACR 20, 50, 70 and EULAR response criteria. And for the audience who are not non-rheumatological audience, these are the criteria by which we assess the disease activity, because we just said that we have to continuously monitor these patients. और ज़्यादातर हमारे पास ये होता है कि patients जो हैं वो 3-3 साल 4-4 साल के बाद आ रहे होते हैं, और 1 साल पहले जिस डोज पे DMR के उनको शुरू किया होता है वो उसी पे ही होते हैं, और आप उनसे पूछेंगे आप ये कब से खा रहे हैं, they'll say for like 3 years we've been on the same treatment. This should not happen, because we have to assess them like very frequently, every 6 to 8 weeks, and active patients every 4 weeks, to see if our treatment is working. This was an open label, single arm, multi-central trial. A total number of 80 patients were planned to be enrolled in the study. There were 5 centers across Pakistan which participated in this study. It started in January. The planned last patient is in 30th January. Till date, we have recruited about 75 patients, and this interim analysis is derived from the data of 22 patients that have completed the 6 months assessment. So this is a 6-month analysis. These were the primary investigators, and these were the different centers. These were the inclusion criteria. They are long. Men and women aged 18 to 80 years. We had the consent form in Urdu in our own language, and patients with the diagnosis of RA according to the old criteria, and a DAS score at baseline. That is the disease activity score by counting the 28 joints, where you see where they're tender, how many joints are tender, how many joints are swollen, and the other measures which you use to deduce this score. And greater than 3.7 means active disease. Inadequate response to traditional DMRs for at least 12 weeks with a stable dose for at least 4 weeks prior to baseline. And stable dose of glucocorticoids, at least less than 10 milligrams. Use of NSAIDs if permitted, but stable dose for the past 2 weeks. Patients who were reproductive age potential were excluded, and they should have had a negative serum pregnancy test. We excluded these people from our study, JIA and rheumatic diseases other than RA or overlap syndromes, and